Island Health, we have observed how you treat your employees and have uncovered your motivations behind your unethical approach to terminating employees who don't complete the Health Career Access Program as a care aide through Sprott Shaw College in Victoria, BC, Canada. We have observed you throw your employees under the bus if they don't generate a benefit to you, even though they are great employees and good people with great intent to do nothing but help humanity. You take advantage of these innocent people and some of their unfortunate circumstances they endure while employed to Island Health, for example. You send your employees to Sprott Shaw College to gain a certification as a care aide and upgrade their credentials so that they won't lose employment with Island Health. But what didn't make sense to us was that these individuals have already worked for Island Health for just under a year already before they are sent to this program at Sprott Shaw College, a well-known fraudulent college that is designed like a pyramid scheme and has had a bad reputation. Sprott Shaw College isn't even accredited with BBB, Better Business Bureau. We also made a very in-depth video exposing Sprott Shaw College. They charge students 3 times more for a tuition than a legitimate college. For example, Camuson College. And as we understand business, it's clear that Island Health has a contract with Sprott Shaw College. You send them your employees. Your employees pay $10,000 for the care aide program at Sprott Shaw College and Island Health gets paid a percentage. Island Health and Sprott Shaw profit from each student a substantial amount of money, putting the student in debt for a poor quality education with unqualified teachers with no experience in the trades they teach, an unprofessional and unsafe environment. So if a student is feeling unsafe, or like the education is not what they had been advertised or expected, and they decide to leave, or even get dismissed for legitimate absence from severe medical complications, even from students who are diabetics, Island Health terminated their employment. A female student was getting harassed and bullied by another hostile student and days later had a miscarriage, and was the same student who is a type 1 diabetic, and ended up in the hospital for 3 days from high blood sugar, which can easily kill you if you're diabetic. And while she was there for this medical emergency, the doctors found she was pregnant and was having a miscarriage, a condition called Bicornuate. A bicornuate uterus occurs when a woman has a uterus that is heart-shaped. Hence, the condition is sometimes referred to as heart-shaped womb. The uterus in the female body is the organ where a fertilized egg grows and develops into a baby, which can cause a miscarriage, which had happened with this student. Indeed, she missed 3 days of class, which she had called, also sent an email to alert the teacher of her current circumstances, and when she returned, gave a doctor's note and documentation dated proof of her miscarriage, and also indicating why she was admitted for 3 days from high blood sugar as she's diabetic. She was already dealing with great stress from school. The female student that was harassing her after class, following her after class, and harassing her on Facebook. And then she had a miscarriage. Sprott Shaw College punished her and penalized her, even though she gave a doctor's note and other documentation, which was disregarded. She was failed for that module, when she has been getting 90s throughout the majority of the 4 months she attended of the 7-month program, and under the pressure, disregard and care to her circumstances and bullying, she dropped out as she didn't feel safe. As a result, Island Health then terminated her employment contract. After she has been dedicated and committed to Island Health, her career and her education, but somehow was thrown under the bus and not even asked why she dropped out. If the school just terminated based off this injustice, we could easily see this was over money and their contract with the corrupt Sprott Shaw pyramid scheme collage. Island Health send them their employees. They pay Sprott Shaw $10,000 for their tuition. Sprott Shaw then gives Island Health a cut. Everyone wins, except the students. They are selling their employees, and if they don't complete the program, they get thrown underneath the bus, swept under the rug, terminated, and not even get asked what their reason or defense was. Sprott Shaw will say they dismissed the student on paper, even after they have given official notice of their reason for dropping out of the program. And seeming education at Camuson College, and this college is very legitimate, has a great reputation, and only charges $3,000 for the same care aid certification that SprotSure offers, but Camuson actually has a quality course and delivers a legitimate and quality education to students and obtains a recognized certification by incorporation companies, organizations and employers so that they can actually obtain employment after schooling. SprotSure does not deliver this, but charges $10,000 for the same certification but doesn't give the same education and isn't legitimately recognized by employers. This is nothing but a business, money over loyalty. Island Health pimps their employees out and then throws them under the bus without hearing the student's side of the story or without even offering a grievance. Island Health loses the contract on the $10,000 from that student. If Island Health's employee doesn't finish the program, SprotSure College gets the $10,000 and the student has to pay the $10,000 back as a debt. Behind the scenes, this is what is actually happening. Here is her testimony from her directly and other ex-employees that have also given their testimony to this corrupt enterprise. The health system alone is distorted, money motivated and corrupt. The medical system is not only saving lives, but causing many to lose their lives. When I was hired by Island Health for the Health Career Access Program, I was to believe that we would be attending Camuson College for the Healthcare Assistant Program. Instead they sent us to SprotSure College, who charges 3 times the amount of tuition that Camuson charges. My former manager's excuse at the time was Camuson wasn't ready for the program, but SprotSure was. No. Island Health only wants money, and because SprotSure charges $10,000 for the Healthcare Assistant Program, Island Health wants their employees to go to SprotSure so they can make money. Even though most employers don't recognize SprotSure as a legitimate college, Island Health had set up the HCAP students to go to SprotSure College. On October 10th I had gone to the emergency room at Victoria General Hospital for a miscarriage and high blood sugars with my diabetes. I was in hospital for 3 days and missed 2 classes. I failed the unit for missing 2 classes, even though I gave them a DR's note and showed proof of miscarriage and proof of hospitalization. I was also being bullied and harassed by a classmate and told the teacher about it, and she said she couldn't do anything about it. The person started to harass me on Facebook, so I had to block them. After blocking, this female student started harassing my boyfriend on Facebook. I was scared for my own safety. This student was aggressive towards me, and I felt threatened. The environment was very unprofessional. The students would mock religions and make fun of them after we had been taught not to so, and I'm also spiritual and felt uncomfortable and offended. Because I failed the unit, the school wanted to make me do 2 weeks of 10-hour school days and put me in a class with another individual who is friends with the student that was bullying and harassing me. I have had problems with the other individual and have blocked her as well on social media accounts because she has given my number out to police, making false criminal accusations against me and my boyfriend as an effort to make herself look like the victim in the situation. This whole experience through SprotSure has affected my mental health and relationship, and probably added to the stress which could have added to my miscarriage. I even showed up for class the day after being discharged from the hospital, because the teacher asked me to after I told her what happened, and they still failed me. I have reached out to my manager at Island Health about transferring to Camuson College and even coming back to work as a support worker while I wait to get into school. I have even offered to pay for my schooling at Camuson myself and continue to pursue my career goals because I want to still work for Island Health. When I sent an email to SprotSure College about dropping out, they acted hostile towards me and acted as if they were the ones kicking me out of school and as if they hadn't gotten my notice that I was dropping out due to the reasons I listed above. So it was clear to me that they were trying to defend themselves by throwing me under the bus. It was an unprofessional environment already, and the teachers didn't even seem qualified in the first place to be teaching, and overall it was a bad experience, and I'm not the first person to experience it that way as well. I looked up at least 100 reviews of similar experiences. I attached all of the documented proof of hospitalization and miscarriage, and I still have the physical copied of paperwork While in school I was getting amazing grades in the 90s, so I believe Sprotshaw was personally attacking me. It's pretty sad that Sprotshaw and Island Health both allow harassment and bullying to happen when both of their values are against harassment and bullying. Due to all of this I was terminated from my position at Island Health, which is unlawful. I didn't do anything wrong and Island Health thinks it's okay to end my employment with them. Another student testimony. I withdraw from HCA program at Sprotshaw College Kelowna last February 2019. I ask for the amount of refund I can possibly get, since I haven't done my practicum yet. I was shocked when Lawley, the financial administrator of the school, sent me an email and learned that I only get $100 refund from what I paid them $9,500. Here are some other reviews on Google. It seems Island Health is not only abusive to those who it class to care for medically, but they are corrupt and abusive to their employees. Every aspect of the medical system in British Columbia is overwhelmingly corrupt. Abusive. Abuse of power. The medical system in British Columbia is killing more people than it's saving. The lack of care. The lack of empathy for its employees and patients in every aspect of every medical related area of Island Health, from hospitals, walk-in clinics, doctors, and the list goes on. It's nothing but a terrible experience for all other than Island Health and upper levels, management included. British Columbia is a money-hungry and authentic satanic corrupt machine that creates problems intentionally so they can offer the solution and profit from it. From homelessness, mental health, addiction and the medical industry. It's all for profit. Hence why humans are chewed up and spit out by this machine. Google reviews. 2.0 False sense of security. Healthcare support worker, former employee, Victoria, BC, the 21st of June 2022. They don't care about you. You can't make complaints. When they're back quote higher up they do what they want. Payroll is a joke, always errors. Always fighting with them for corrections. Pros the pay, cons everything else. 2.0 False sense of security. Healthcare support worker, former employee, Victoria, BC, the 21st of June 2022. They don't care about you. You can't make complaints. When they're back quote higher up they do what they want. Payroll is a joke, always errors. Always fighting with them for corrections. Pros the pay, cons everything else. Ratings by category. 3.0 Work/life balance 3.0 out of 5 stars for work/life balance. 5.0 Salary/benefits 5.0 out of 5 stars for salary/benefits. 5.0 Job security/advancement 5.0 out of 5 stars. For job security/advancement. 2.0 Management 2.0 out of 5 stars for management. 3.0 Culture 3.0 out of 5 stars for culture. Was this review helpful? Similar review. Same role. 3.0 Unsupportive management and work can be stressful. Healthcare worker, current employee, Vancouver Island, BC, the 2nd of April 2021. Left hand doesn't seem to know what the right hand is doing. Management hard to connect with and unhelpful. Understaffed and underpaid frontline workers. Management and leader heavy. Pros working with people, cons understaffed. Frontline. Was this review helpful? Same role. 2.0 Bad management of it all. Harassment thrives. Healthcare worker, former employee, Saanich, the 19th of March 2016. Unionized. Extremely challenging. Many complacent employees waiting to retire. If you get a good team to work with then be happy about it. It's hard to get through a shift without an undertrained or non-caring team member making your workload unbearable. Lack of accountability and too much he said she said. Union will help, but even they can't right all the wrongs. Sideways bullying and harassment from the top is rampant. Pros days off, cons some atmospheres are toxic. 2.0 Wages not up to par with cost of living. Administration assistant, former employee, Victoria, BC, the 1st of February 2023. The hourly wage is not up to par with the cost of living here on the island. The benefits are great. However, after your 3-month probation the company starts taking 8.5% off of your net pay each paycheck for an extra pension plan in addition to CPP. You are not allowed to opt out of it, nor are you allowed to change the amount that they take. It's too much money to take when the cost of living is so high to begin with. Hourly wages need to be higher to factor that in. They also make you pay for parking, which is also a lot of money. Cons: not a high enough wage. 1.0 Disrespectful towards housekeeper, current employee, RJH, the 15th of January 2023. They have brought housekeeping back. They have done everything possible to make me feel unappreciated. The only staff they care about is nurses. Housekeeping is the last thing they concern themselves with. Shifts go empty because they won't allow regular staff to apply for overtime. Overtime is for nursing staff, it seems.